rural spaces, rolling hills, and small towns with one street. These places, particularly the Appalachian region of the United States, experience hardship as well. In fact, poverty rates in this area range from 6.5% to 41%. But why is that? What experiences or harm do these people have that make their rates of poverty large relative to other areas? Folks in the Appalachian area experience great limitations due to the restrictive coal mining industry controlled by external corporations, particularly physical and financial harms. These ultimately manifest through harms to bodily health, sense, imagination and thought, and affiliation, all of which we will define in a few minutes. For people like Daniel Alexander Hawkins, mining has been the profession of men in his family for generations. He is concerned over the vicious cycle of long shifts and mandatory overtime that miners face. Many of the men he works with are burdened with large debts. However, some even plan what payment they can afford based on how much overtime they plan on working. At one point, Daniel had dreams of going to college in order to avoid the coal industry, but he wasn't able to due to a lack of funding and quality education. He says that all my attempts were met with failure, returning me to the mountains I love. Daniel isn't the only miner who tried but failed to avoid the industry's death grip on Appalachia. One of the goals of this project is to highlight how escape is almost impossible. In order to break down what hardships people are facing, we ought to clarify who we're talking about: people living in Appalachia. According to the Appalachian Regional Commission, 25.7 million people live in this region that you see here. To put it in perspective, New York City has roughly 8.4 million people. When outsiders think of the area, they think of poor white rednecks. However, Appalachia, like other parts of America, is racially diverse. While 81.4% of the population is white, 18.6% is a combination of Black, Latino, or other. However, this does not account for those who are mixed or Melanesian, those who are of mixed European, African, and Native American descent. The unfortunate stereotype of the poor white redneck blinds outsiders to a huge portion of the population, and thus forcing unattainable expectations of Appalachian. Appalachia is covered in rolling hills and mountains, which make it the perfect space for harvesting natural resources. The war on coal. Coal keeps the lights on. Dirty energy. These are some of the phrases being thrown around about mining. It seems as if the intense mining here would actually help people. These resources equals money, which would bring them financial security, right? Well, no, it's not that easy. People face financial harm due to coal mining as well as bodily harm. The industry in many ways seems to limit one's ability to have a flourishing life. To borrow the words of Martha Nussbaum, a philosopher who works on the approach to life that centers around the 10 key capabilities. These capabilities allow for people to have choices in their lives, which miners lack. If one has all 10 capabilities, they are able to live a happy and worthwhile life. However, if one is missing, they will suffer in one way or another. While addressing survival-based resources, the capabilities also focus on the little things that it means to be human. One puzzling question that most people may not initially think about is, why would people face financial harm when they have one of the most wealthy industries in their backyard? Ever since 1949, coal production and consumption has been on a steep rise, with a small downturn in 2009. At the same time, coal mining employment numbers have roughly remained the same from 2000 to 2011, with a sharp drop-off in 2011. The number of people being let go from coal plants is connected to the automation of coal mining, similar to other low-skilled, high-risk jobs. These once miners are left with limited options because of their low education levels and specialized skill set in the labor force. In addition, the fruitful, abundant land Appalachia farmers once had is now barren because of all the toxins from the mountaintop removal. The once mountains are now closer to plains. and these farming families have the so-called choice to either be lowballed and exploited by the coal companies for their land, or to move from the place that had been in their lineage for generations with nowhere else to turn. In addition to these explicit financial harms, coal mining also has more subtle impacts. Given a lack of urban development, some areas face isolation, with the Appalachian region having less miles of highways and less internet access than the US overall. Also, even though coal mining is on the decline, in West Virginia, for example, much of the state's private land is still owned by large, mainly absentee corporations. The list of top owners, once dominated by energy, landholding, and paper companies, now includes major timber management concerns as well. As seen here, some areas have over 50% private ownership. Thus, people in Appalachia are limited by the state of land. The second and perhaps more striking problem is the physical impact that living in a place like this can have. While moving through the day, the average person does not think about the pollutants that may be around them, whether it be in the air, in the soil, or in the water. Folks in Appalachia who live in proximity to coal, however, do have to think about these things. Although down from the 1,500 coal-producing mines in 2008, there are still 551 mines in Appalachia. Furthermore, the damage to the environment and people's health has already been done, and there's not really anything that can be done to reverse this damage after decades of carnage. It can be tricky to imagine what pollution looks like without clear examples. One pollutant is called fly ash, and it is a result of the combustion of coal. Upon being released into the air, humans inhale it, resulting in higher morbidity and mortality from respiratory, cardiovascular, and cerebrovascular diseases and lung cancer. The ash can also come into contact with the ground and sources of water, causing it to be infused with toxins. The health problems exist earlier in the process too. The folks who actually mine the coal are exposed even more further. For instance, cancer mortality rates are 10% higher, chronic obstructive pulmonary diseases mortality rates are 27% higher, injury mortality rates are 33% higher, stroke mortality rates are 14% higher, diabetes mortality rate is 11% higher, and heart disease mortality rates are 17% higher in Appalachia than anywhere else in the country. Unfortunately, the families that have lived in Appalachia for generations have no say in what is being done to the area. Outside corporations are coming in to mine and profit off Appalachia's resources, with little concern for those that live there. Because these mining companies are largely removed from Appalachia via headquarters hundreds of miles away, they have no direct line of contact to recognize the physical and financial harms occurring. At this point, it makes sense to ask if the statistics are this drastic and debilitating. Then why has it not been solved yet? Well, it's not that easy to answer. Factors like the single industry of coal mining and the specialized skill set requiring little to no education make change difficult. On average, 86.4% of people in Appalachia graduate high school, which is slightly lower than the US average of 87.3%. However, graduation rates range from 58.2 to 94.5. In certain regions of Appalachia, such as eastern Kentucky, extremely high poverty rates coincide with low rates of achievement, particularly in regard to high school graduation rates. Even as service positions become more popular in Appalachia, without a high school degree, those are difficult to attain. Regarding northbound's capabilities, sense, thoughts, imagination, affiliation, and control over one's environment are generally restricted in these areas. Many of those who live in Appalachia do not have the educational background to choose their profession, backing them into a corner when coal mining and other similar fields are becoming increasingly automated. In addition, these people's self-respect is at risk because of not being able to provide the basics for their family. Furthermore, there is a stigma in the United States associated with unemployment of laziness, and these people are held down by it. Finally, as outlined earlier, these people are left with a spurious choice, masking their entrapment to the single-path life that is being ripped away from them. Through understanding these harms, we can lift up the voices and experience of Appalachians and consider solutions together. However, this is something that will be discussed in the third section of this project. We are next moving into structural analysis. In order to understand the harms that we discussed in our last project, it is important to recognize the institutions and social structures that keep them in place. The three sections will highlight the nature of relationships in Appalachia, the rules that exist in this region, whether they be legal or normative, and the way that the varying parties are represented, which can be positive or negative. Jeremy Davidson, a 3-year-old boy from Virginia, Billy and Eileen Tussey, an elderly couple from Kentucky, Roy Mullins, Paul Kinder, and Charles Shortridge, coal miners from Virginia. The lives of all of these individuals were impacted by coal, whether it be in the case of being crushed with a boulder, as with 3-year-old Jeremy Davidson, having their house be destroyed, like the Tusseys, or contracting black lung disease due to mining work, such as with the Virginia miners. Although these people lived in different spaces, were different ages, and experienced different circumstances, they had a commonality. These individuals were Appalachians, those living in the Appalachian region of the United States. However, there is no single story for all Appalachians. Many face similar experiences of exploitation and hardships due to the mines that surround their lives. Normalcy in their shared spaces unite these people. So, these people have all had negative experiences due to a common malice. However, we have yet to define what malice is in this situation. Of course, as we have previously discussed, coal mining is harming individuals. Yet, what relationships exist within that general statement, and what is the nature of those relationships? In these previous examples, we can identify a few. The miner with their employer, individuals living near mining sites, and the corporations who have the possibility to interact with them, and those who live in spaces occupied by miners with no ability to communicate with the corporations due to not being in the field of mining. In these situations, it seems as if the corporation or the employer of the miners is asserting itself as the dominant presence, practically forcing individuals into subordination, both within their business and outside of their business. We see how miners are placed into subordination through improper working conditions. Those who loved their jobs and were obviously willing to risk a lot for their employers ultimately suffered irreversible consequences. Shortridge himself, a miner who now has permanent health problems, asserted how much he loved working in coal mining areas, in coal mines. That's all he knew, and that's how miners provided for their family. The love and financial reliance of the coal miner on the corporation is taken advantage of, revealing that the relationship is unbalanced and hierarchical. The stories of these miners, as told in their interview with PBS, seems to line up well with the numbers and statistics that are being reported. In particular, black lung develops from the inhalation of coal over long years of work. A study conducted by the CDC shows that 20.6% of long tenure miners who were tested in Kentucky, Virginia, and West Virginia tested positive for black lung. We mentioned many health effects that miners go through. Yet, it is not just the miners who suffer, as everyone who lives in these areas will. Health risks are much worse in Appalachia than the rest of the country. Cancer mortality rates are 10% higher. Chronic obstructive pulmonary disease mortality rates are 27% higher. Injury mortality rates are 33% higher. Stroke mortality rates are 14% higher. Diabetes mortality rate is 11% higher. And heart disease mortality rates are 17% higher. Some subordination also takes place in the form of larger entities. Those possessing privilege and resources have the ability to manipulate laws and people. An example of this can be seen with Jeremy Davidson, the 3-year-old who was crushed by a boulder from a mining site in Virginia. In response to his death, Jeremy's family sued A&G Coal Corporation due to gross negligence for numerous reasons. According to Joseph Witt, the company was fined $15,000, the maximum at the time. This seems unjust, but are there other examples of coal mines bending the rules in order to escape consequences? How do the families living around corporations and mining sites avoid being exploited? According to miner No Accounts from Clintwood, Virginia, corporations try to act like they are complying with the laws, but even the inspectors know they are not. His peer, Edward Fuller, notes that you had to do what they said. If you didn't, it was your hide. So based on these first-hand accounts, we have reason to believe that the coal industry may not be acting completely correctly. Let's dig further. Due to so much of the land in Appalachia being privately owned by these mining corporations, the miners and everyday people do not have anywhere to turn in times of hardships. The private ownership of the land allows the mine operators to dictate where people can shop and live. Through the monopolistic control of food and clothing and tools and powder, the coal companies were able to render wage rates and wage increases meaningless. Of course, in addition to these abuses, there are laws in place to aid miners in facing injustice that may occur in the workplace. For example, the West Virginia Wrongful Death Act, which outlines the rights and circumstances that allow someone to sue because of a wrongful death. Yet, restrictions upon the act exist, such as the fact that deaths before 1988 do not fall under the provisions. Many representations exist that both harm and enable individuals in these relationships we discussed earlier. The miners, corporations, and surrounding individuals are all perceived negatively by some and positively by others. The miner, given that they are the subordinate in the relationship, can be perceived as weak. They are also associated with whiteness and masculinity. Even in the positive circumstance, when they are not perceived to be uneducated and weak, they are victimized. Corporations are perceived in many circumstances in one of two ways. They are either heroic or evil. They oftentimes are viewed as heroic by those who work for them, as they offer financial stability to employees. Despite these central images, there were female miners and miners of all races, not just white. Similarly, as this project has gone out of its way to describe, the corporations were mainly evil and creating problems for both the miners and residents of rural Appalachia. Through understanding the representation, relations, and rules within the Appalachian region, especially those between Appalachians and larger corporations, we can begin to dismantle harms and attempt to create solutions for them, as we will explore in this next section. As we have been talking about this whole time, many results of the coal mining industry are severely unjust, from the health condition of workers to miserable climate change to the silencing of locals who experience life-altering events due to lack of regulations. Let's take a deep dive into the health condition of coal miners and the lack of liability for coal mining companies in order to assess the current unjust situation. As we have stated, coal miners experience a plethora of negative health effects. Yet, how exactly are these things unjust, and to what degree are they unjust? The sacrifices that occur on account of the coal miner are difficult for one to reject when assessed further. The risk they are taking, logically, ought to be met with protections because of their frequency and severity. Currently, according to the miners that we heard from in the last video, those protections that are supposedly in place are not being respected and followed by their employers. Due to the growing amount of poor health among miners and the lack of liability that coal mining companies face, we suggest that CPDM devices must be worn by all miners at all times, and that regulation of the industry must increase as a whole. Considering the many voices that disagree with our assertions here and find the practice of coal mining necessary for jobs and low-cost energy, it is not feasible to completely rid our country of the coal industry. However, it is somewhat difficult to devise an ethical solution that is politically feasible. Even so, some specific yet powerful moves could be made in order to reduce the harm experienced by coal miners and increase accountability for coal mining corporations as they interact with the local community. Much of the health difficulties experienced by local miners are a result of their difficult working conditions. Increased risk of respiratory diseases, particularly black lung, is a direct result of prolonged exposure to ash and dust under the surface. There is some legislation in place in order to decrease these issues as it comes to bodily health and personal safety. One of the Federal Mine Safety and Health Administration Act of 1977, which has a key protections, numerous annual inspections of mines, more rights for miners, security against retribution from their employers for the miners, additional mandatory training, and mine rescue teams at the ready. Even though certain legislation may be in place, various committees of the National Academies of Sciences, Engineering, and Medicine indicate that it may not be enforced or working to the best of its abilities. For example, the CDC and the National Academy of Sciences emphasizes the importance of a device called a Continuous Personal Dust Monitor, CPDM, which alerts miners of when there is a toxic amount of dust in the air. However, only a small fraction of coal miners are required to use a CPDM during any given shift, even though it could be key in preventing black lung disease. Additionally, those who are required to have it are only sampled quarterly, thus resulting in a policy that is difficult to enforce. Therefore, the simple requirements for miners to use CPDM devices could result in less miners falling ill with respiratory diseases, and for more research to be completed about the safety of coal mining, thus helping create better policies for the future. One may say these proposed solutions are not enough, that the health of coal miners is so much worse than the average person that we ought to do more. Perhaps we should rid our society of mining altogether. This is not necessarily incorrect, yet in creating change, one has to start somewhere, preferably in a place that is politically feasible. By increasing the amount of miners wearing CPDM devices, miners would be more aware of when they are in direct danger, thus aiding their capability to attain bodily health. Regardless of whether one is pro or anti-coal, we all ought to be in favor of helping protect lives. The actual act of mining is not being adjusted in these circumstances, but the safety of miners will be improved. There is no adverse effect, so why not implement this? Perhaps the reason why folks choose not to use them is because of the faulty nature of technology. In certain cases, the CPDM does not work, whether it's because of the temperature, battery life, or technology issues. Yet, a company cited by the CDC notes that after implementing the CPDM samples, reported a 20% reduction in dust concentrations. Given this incredible reduction, one should use a CPDM, even if there's a slight chance it would not be effective, as it protects them from extensive health impacts. There is no reason to ignore the health of individuals as we continue to work toward being a more eco-friendly nation. Besides just the concern for poor health conditions for the miners, there also should be attention drawn to the lack of liability that the coal mining companies may have because of all the damage that coal mining companies are creating for both the environment and people in these areas. Whether they are the miners themselves or just residents of Appalachia, they should be held liable by the law. As mentioned earlier, MSHA protects the miners from the exploitation of the mining companies. Penalties that the mining companies can face for damages are capped at $10,000. Later, the Miner Act, amended Section 110 of the Mine Act, raised the maximum penalty to $220,000. However, in 2007, the Miner Act was amended yet again to lower the maximum penalty to only $70,000. Why are the mining companies less liable now than they used to be, especially if they have not changed their exploitative ways? Also, how can one put a price on one's health or life? Is that not something that depends on the situation or severity, meaning there should be no maximum? Earlier parts explained how companies were barely held liable for huge property damages and even losses of life. One liable group that the public generally ignores is the federal government, who has repealed numerous acts that once protected Appalachia. In order to prevent further damage by mountaintop removal on the streams and wildlife, the Stream Protection Rule was proposed by the Obama Department of Interior in 2016. This law would have controlled the impact of dumping the mountain rubble in nearby valleys and waterways. However, it was disapproved by the Trump-era Congress and President himself. Another unpopular choice, yet necessary, is one that decreases the amount of coal mining plants in the country. Due to the continual exploitation of the miners and the environment, as demonstrated in this project, coal mining should be decreased. It is unjust to force these harms on Appalachians and the environment when the consequences outweigh the benefits. In 2017, President Trump ended Obama's restriction on federal leases for coal mining. While in the past few decades, coal mining has been on the decline, it will soon start to increase again. These regulations, and others like it, must be raised in order to ensure the prosperity of Appalachia. Overall, over the past few decades, coal mining was an industry that had begun to increase in regulation. However, within the past 5 years, these regulations once in place are being revoked. This is a complicated situation to address. On one hand, the miners are being affected because they are not being respected, similar to the health issues mentioned earlier. But on the other hand, the coal companies will not be able to produce as much coal for the country with these regulations in place. Therefore, they will have to lay off some of their workplace to counter these losses. The country has two choices: protect the miners or protect their livelihoods. Overall, the American public does not lose as much as the miners do in this situation. Yes, they may have to pay more in taxes or switch to a different energy source. However, they will not risk the contraction of a deadly disease or face a shorter life expectancy as these miners currently do. How can one compare the two? There is also the point that hard-working miners will lose their jobs. Because of the added regulations, companies may scale back their employee base, and the people that rely on the coal mining industry will suffer. However, we believe that in the long run, these regulations and protections for coal miners and the environment are imperative for the well-being of Appalachia. These injustices cannot be ignored anymore, and coal companies must stop exploiting Appalachians just because their lives seemingly rely on the industry. The contractualist approach we are taking allows us to focus on the political feasibility of our suggestions. T.M. Skowron developed contractualism as the way to describe an act as wrong if it is disallowed by a principle that no one would reasonably reject. In our case, this means that there is no point in devoting resources to a larger scale solution, like getting rid of coal, because there are numerous groups that will reject it. However, our solutions revolving around CPDM devices and greater regulation of the industry do not have any complaints that are greater than or equal to implementing them. With the devices, the miners are the ones most affected by not having them due to adverse health issues that will arise. While the company pays for the devices, they will be losing less than the miners, who would eventually lose their lives without the implementation of this technology. Regarding the greater regulations of companies and additional liability in the industry, this also follows a contractualist viewpoint. The companies are the only ones losing out here. Yes, they will lose money, but at what cost? If a company is indirectly or directly responsible for an injury or death, they should have to pay the consequences. There should not be a cap on these payments either, because every situation is different. And how can you put a price on a life? Poverty in Appalachia has not been an easy topic to evaluate and determine potential solutions. It is much more complex than one may initially expect. We started out by examining who we are talking about and the harms the people of Appalachia experienced. In the next part, we examine the structures that exist in Appalachia and beyond. Finally, in this third part of our project, we have worked to come up with two potential solutions that are politically feasible enough to be implemented. A requirement for miners to wear CPDM devices and to yet again regulate the industry. We hope that these two are accomplished, there will be more justice in Appalachia.